This morning in Health Watch, food and drug interactions. If you're taking particular prescription medications, there are certain foods you have to avoid. Registered dietitian Keri Glassman is here this morning with all of the information we need on all the food and drink groups. How are you, Keri? Good to see you.
Nice to see you.
So, cheese.
If you're taking MAO inhibitors, you want to avoid aged cheeses. Also, things like soy and wine. They have something called tyramine in it, and what that is going to do is when combined with those MAO inhibitors, antidepressants such as Nardil, it's going to increase your blood pressure.
Okay,
so definitely stay away.
Alcohol not great, I guess, for any type of medications, which would seem rather obvious, but...
Absolutely, and don't even sneak a sip in, because if it says don't have any alcohol, you're going to end up with your head in the toilet, or you're going to heighten the sensitivity of the side effects, such as drowsiness or stomach ache. So anything from anti-anxiety meds, antidepressants, beta blockers, cold and flu, over-the-counter medicines, you really want to stay away.
The MAO inhibitors you talked about, excuse my ignorance, but those are?
Antidepressants, most antidepressants such as a Nardil.
This looks like a cocktail party right here. The cheese, we've got the wine, the vodka.
Exactly. So if you're on any meds, stay away. Stay home.
Exactly. Don't go to cocktail parties. Don't even RSVP.
Exactly.
Caffeinated drinks now, we've got the Snapples, you've got the Pepsis, the Cokes, the Red Bull.
Caffeinated beverages, you want to stay from asthma medications and decongestants. What's going to happen there is you're going to increase jitterness, so especially if you get jittery from coffee anyway, also heart palpitations, because those medications are going to do that anyway, so definitely stay away from the caffeine.
Move down the table here, now we're looking at some more dairy products, milk, yogurts, cottage cheeses.
Yep. Dairy, if you're on antibiotics, what the dairy is going to do is it's going to decrease the absorption of the medication. So if you have an ear infection and it's not going away, check your diet. If you've been eating yogurt every day, that could be why.
Do a lot of the medications have these warnings on?
They do.
Or is it something you need to really kind of look up for each?
Well, you need to ask your doctor. You need to really read the labels, but they're also a little confusing.
You know, grapefruit juice?
Grapefruit juice, blood thinners, cholesterol-lowering meds, stay away. What happens is all drugs are made knowing that the enzymes in your stomach are going to decrease the effectiveness a little bit. What happens is the grapefruit juice kills that effectiveness, so you're going to increase more. At worst case, renal failure. Best case, you might get a stomach ache.
Yeah. Stay away from the worst case. And finally, some leafy green vegetables.
If you're on blood thinners, such as Coumadin, stay away. Leafy greens have vitamin K, which does the opposite. They actually clot your blood, so stay away. If you eat a salad every day, be consistent, don't become Popeye and eat more.
Gotcha. All right, Keri Glassman, thank you. If you're on any prescription medications, just make sure you take note of this. Or obviously go online, do whatever you have to. Just make sure you don't mix and match.